I'm Britton Lund.
All right, we're here talking about heart problems in our dogs this morning. Dr. Jerome Williams, of course, is a regular from the Red Mountain Animal Clinic here on Good Day, Alabama. He's brought along an expert, Dr. Ingrid Strader-Nolan, a veterinary cardiologist. Good morning and welcome back again.
Good morning.
Good morning.
This is something that I know from personal experience can be really scary when your dog has a heart problem.
Yes, absolutely.
So how does it demonstrate, how does it manifest for you to have them referred to Dr. Nolan?
Well, if we want to do the best by our larger breed dogs, then screening for heart condition, arrhythmia, which is the irregular heartbeat in the dog, is best done by help from Dr. Strader-Nolan.
You're talking specifically about larger dogs because it may be harder to detect, is that right?
No, that too, but they can actually have that without even anybody knowing it.
Right.
And it's in the beginning very insidious, nobody would know it, no real good symptoms. Maybe, and it's really advanced, you would see symptoms, you can see weakness when they exercise. Sometimes they even have a scary thing like what we call a syncope, which is actually a fainting episode. But sometimes you see nothing at all, so it's nice to actually be able to screen that.
Now you have a dog here and you're going to demonstrate
Yeah, she's a little nervous. But we have the so-called Holter monitor. It's very nice, it's very easy, doesn't bother the dog much, maybe a little bit in the beginning, but you put some leads on the side, like this on the dog, just like in a human actually. Kind of have to shave a little area and put it on. And then you have this very lightweight little monitor, and you put this on her back and have it wrapped up, and you leave it there for 24 hours and ask the owners to actually keep a very good diary for me, because 24 hours is sometimes a long time, and I need to know later on what did the dog do at what time, and I can then kind of match it. Hopefully I won't see what we have right here, but sometimes of course I will. This was just a 2-year-old Labradoodle, very young dog, and luckily the screening veterinarian heard an arrhythmia.
One is a before and after, so what are we seeing in this one?
So I have a little bit of a orange mark right here in the before, and you can tell each time I had a mark, it goes on and on and on, there's an abnormal beat. In this case, a so-called ventricular premature contraction, or VPC. So we found that it was even worse when the dog was exercised, or when the owners came home, he was all happy. It got actually even worse than that.
Okay, now the other is the after. What are we seeing?
Yes, so we were able to treat that dog. Luckily, we have some very good antiarrhythmics for that. And this is the nice shot afterwards. You can tell not a single abnormal beat. Of course, I get pages and pages of this.
So is that treatment with medicine or?
It's just medicine.
Wow.
It's about twice a day. In normal times, it's twice a day, and it works extremely well. It can really save their life and or prolong it for a long time.
Doctor, I believe you told me that some clubs, some associations or groups have these that they'll share with their members.
That's true. I heard that several breeders and their clubs sometimes already have those Holter monitors. They probably send it in. I'm not quite sure who reads it for them, but you know, I definitely have it too. So it's nice to have it as a good screening tool.
So once again, quickly, we're out of time, but quickly, what are the symptoms of something like that that people may not recognize really quickly?
They can be weak suddenly, exercise intolerant. They can have a fainting episode, very scary, or they can have nothing at all. Might be good to go to your veterinarian anyways.
Okay, good advice. Thank you so much, both of you, for joining us this morning.
Always
Thank
good
you.
to be here.
All right. Here's JJ.